Attention to joint swelling and aches. Don't confuse arthritis anymore. Arthritis refers to inflammation in one or more joints of the body. When white blood cells fight infections, inflammation can occur, causing aches, stiffness, and swelling in the joints. There are many different types of arthritis, with osteoarthritis being the most common. Although osteoarthritis, rheumatoid arthritis, and gout are all types of arthritis that affect the joints and cause joint aches, the truth is that they are very different. Type 1, Osteoarthritis. Osteoarthritis is the most common joint disease, characterized by the degeneration, destruction, and secondary bone growth of joint cartilage. It is common in older people, with a 50% prevalence rate in people over 60 years old and almost 100% in people over 80 years old. It is mainly caused by continuous wear and tear of the cartilage in the joints. The main symptoms are joint aches and repeated swelling, especially more apparent after exercise. There may be bone growth or spurs along the edges of the joints, and there may be popping sounds or weakness in the joints during movement. The disability rate of osteoarthritis is as high as 53%, making it the #1 killer of disability in the elderly. In addition, obesity, excessive or improper exercise, and traumatic injury are all important factors in developing osteoarthritis. Type 2, Rheumatoid Arthritis. Rheumatoid arthritis is a chronic, systemic disease of unknown cause mainly characterized by synovitis. Its characteristics are multiple, symmetric, and invasive joint inflammation in the small joints of the hands and feet, often improving after activity and worsening when at rest. The incidence rate among women is 2 to 3 times that of men, and the age of onset is usually between 40 and 60 years old. The main symptoms are joint ache, swelling, stiffness, limited mobility, and joint tenderness. Type 3, Gouty Arthritis. Gouty arthritis is a metabolic disorder caused by purine metabolism disorders and increased blood uric acid levels, resulting in recurrent attacks of acute arthritis, tophi deposition, and joint deformities. Tophi are urate crystals deposited in soft tissues, invading the bones near the joints, causing bone deformities, or damaging the bone structure. These gout nodules can also be found in synovial membranes, tendon sheaths, and cartilage near the joints. How to prevent joint inflammation? Joint inflammation, although not life-threatening, can affect most people's daily activities and their quality of life. Initially, symptoms may not be noticeable, but after years of slow accumulation, recurring aches, and knee joint swelling may appear. Although osteoarthritis cannot be completely prevented, some simple measures can be taken to slow its progression. To combat aches, joint inflammation must be addressed first to prevent the condition from worsening. Especially in middle-aged and elderly people, once the knee joint becomes inflamed, the ache becomes more severe, and swelling and internal fluid buildup may occur. Certain occupations, intense exercise, and injuries can put excessive pressure on joints, which can cause degenerative changes in cartilage cells. The degenerated cells then cause a reduction in matrix synthesis, leading to even more damage to cartilage cells, forming a vicious cycle. Even seemingly minor injuries, such as tripping, can become a cause of osteoarthritis, with over 100 types in total. So, what are the prevention methods for preventing joint inflammation and ache? Conway Ultra Joint is a combination of substances used to prevent joint inflammation and relieve joint soreness. It can help alleviate inflammation, stiffness, swelling, and back pain, and repair joint injuries. It also reduces arthritis and ache, and minimizes the destruction of joint cartilage, with clear anti-inflammatory, analgesic, and anti-gout effects. To strengthen the prevention of joint inflammation, Conway Ultra Joint has added hyaluronic acid and chitosan to the original formula, which can enhance joint lubrication, and reduce joint friction and wear, protecting joint cartilage. Conway Ultra Joint has a good preventive and therapeutic effect, achieving a dual effect of healthcare and treatment. So why wait? Discover Conway Ultra Joint today and take the first step towards a pain-free life. It's time to say goodbye to knee aches and hello to a better quality of life. Don't let knee cartilage erosion hold you back. Try Conway Ultra Joint and experience the difference. Conway Ultra Joint is available in Singapore pharmacies and TCM stores. The retail price is 58 Singapore dollars only. Inquiry at 6562-5526. 6562-5526.